What are the procedures for involuntary admission? Most of the time, hospitalization is arranged with the consent of the patient. However, if the patient is unstable, such as displaying behaviors that threaten themselves or others, the patient may be subjected to involuntary admission. Eligibility of applicant. Involuntary admission can be requested by family members, registered doctors, or certified social workers approved by the Social Welfare Department. Considerations of the application. A judge will decide whether the patient needs to be admitted for observation and treatment based on the history and symptoms of the patient. Involuntary admission aims to ensure the safety and health of the patient, as well as the safety of others. Duration of involuntary admission. The general duration is 7 days, but can be extended up to a maximum of 21 days. Discharge from hospital. Priority follow-up. Upon discharge from the hospital, the responsible physician will decide whether they need priority follow-up based on the patient's condition. The patient will be evaluated by professionals before they are allowed to leave the hospital. The assessment criteria include the patient's extent of recovery, violent tendencies, suicidal tendencies, compliance to medication instructions, and support from the family and community. Before the patient is discharged, the hospital will arrange appropriate rehabilitation services for them in order to help them adapt after discharge. Professionals will also schedule follow-ups for the patient depending on their condition, either at specialist outpatient clinic or psychiatric day hospitals, and if necessary, with visits provided by the community psychiatric nursing services. Patients who are subjected to priority follow-up will be reviewed by a senior psychiatrist prior to their discharge from hospital, and they would only be allowed to leave if the doctor agrees with the arrangement and completes their condition reviewing process. Patients will also have special follow-ups by the community psychiatric nursing services, including home visits, as well as having a senior psychiatrist see them at specialist outpatient clinics. The support for these priority follow-up patients is more intensive in order to enhance recovery and reduce the risk of potential harm. If family members notice an unstable mental state in a priority follow-up patient, they should contact the patient's community psychiatric nurse for advice on how to manage the situation, or in an emergency, call the police for help.